Let's face facts. There are indeed more people getting health care with the Affordable Health Care Act. But they're not getting care at the prices they were promised. There are more loopholes here than in a Kardashian marriage contract. And it has given plenty of assistance to those seeking to gouge patients at every step along the way. His new book is entitled America's Bitter Pill: Money, Politics, Backroom Deals, and the Fight to Fix Our Broken Healthcare System. It's a pleasure to welcome author Stephen Brill to MidPoint. Stephen, thank you so much for being here.
Hi, thank you. I'm just curious, why are you saying people aren't getting care at the prices they were promised?
Because there are certainly people, and I know a lot of people, who have gotten their new premiums, and the premiums are not what they were promised. They're more expensive.
Well, sure, because they have, much better insurance. I mean, the issue with Obamacare isn't that people aren't getting affordable insurance and affordable care. The issue is that the reason they're getting that affordable insurance is the federal government is paying a subsidy so that their premiums stay low. And that is something that we can't afford because we didn't do anything about the essential problem with healthcare, which is that the prices are just way too high.
Well, the prices are way too high, and I do want to get into this, but you will admit that there are people out there who are paying more in their premiums. They're paying more than they thought they would be paying, and then, of course, we still have an issue. And again, I only have to come down to what is basically my own experience with friends of mine I know who have gone into the exchanges where they are not allowed to have the doctors that they need, and they feel they're getting substandard care.
Well, that's been the case, with private insurance, all the time. Doctors and hospitals go in and out of networks, and insurance premiums have been going up since the 1960s and 70s. So Obamacare hasn't changed that, hasn't improved it, but it hasn't changed that. The real change, again, is that lots more people have the opportunity to get health care so that we start to lose our distinction as the only country in the free world where everybody can't get health care. But the problem with that is that the drug companies, the nonprofit hospitals, the device makers basically got a boondoggle because the federal government is paying a subsidy so that they can keep their prices as high as they ever were.
Is it not fair to say, though, that these are things that we've really had happen for years now? Because, I'll go back 20 years ago to my medical friends would tell me that they knew at that time, and I'm speaking 20 years, where they knew hospitals were gouging patients, drug companies were gouging patients,
exactly. That's
doctors
exactly
were
right.
gouging patients. So then why is this, after all this discussion, after all of the back and forth, Republican, Democrat, Independent, whomever you want to call, why is it that we're still back here at the same place where we are still basically subsidizing people to become wealthy at the hands of people who don't feel they're getting great care?
Well, because that's the way Washington works. As I recount in the book, what we did was we took a dysfunctional Washington and tried to fix a dysfunctional healthcare system. And what happens in Washington is the health industry lobby, which spends 4 times as much as even the military-industrial complex to lobby, got the kind of, quote, reform they wanted, which was, let's keep all the prices the same, let's keep the lack of accountability the same, but let's just have the federal government buy that care for tens of millions of more people.
What about those who talk to the fact, and again, I'm looking right now at an article in Forbes that looked at your book and looked at many things that you said, and it points out here, according to them, they say that the good part about this is the government will eliminate nearly $1 trillion in Medicare payments to hospitals over a decade. Did they get it right?
What the Affordable Care Act does is it slows the increase in Medicare payments to hospitals, which is not cutting payments. And the second thing it does is it does extract a small penalty for hospitals that have bad readmission rates. In other words, if a patient is readmitted within a month of when they're discharged, if they have too high a rate of that, there's a penalty. But I should tell you, the hospital lobbyists got to the Democrats and the Republicans on Capitol Hill and got that penalty cut by 1/3 before the final bill was passed.
Is this, at the end of the day, and about another 30 seconds, we'll take a break, but at the end of the day, merely just another example of people who go to Washington, say they're going to do the best things for their constituents, the lobbyists come up, promise them everything, and they basically throw everything to the side and just let the lobbyists lead them with the nose?
That's pretty much what this is, and that's why I wrote the book.
All right. Well, I want you to stand by because we want to dig a little bit deeper into the book and your own personal experiences as well and what brought you here. Stephen Brill stays with us after a short break. We are going to dig deeper into the future thanks to Obamacare and a government that has simply set a tone that, according to him and many others, there may be no recovery from. And join me at 51 minutes after the hour, telling it like it is, as I throw down a challenge to broadcast networks and my peers everywhere who give time and a platform to a hateful so-called Islamic cleric. That and so much more coming up right here on MidPoint, where we question everything.
Hi.
Welcome back to MidPoint. Author of the new book, America's Bitter Pill, Politics, Backroom Deals, and the Fight to Fix Our Broken Healthcare System, Stephen Brill joins us from New York. Stephen, you actually had your own experience with the healthcare system that forced you to write this book. Tell us a little bit about it.
Well, it didn't force me to write the book. It happened as I was finishing most of the reporting for the book. I have always been healthy. I haven't missed a day of work for illness in years. And just at the tail end of the reporting, during a routine checkup, a doctor discovered a problem with my heart, and I had to have open heart surgery very urgently. I had no symptoms. It was something called an aneurysm. And that gave me a different kind of perspective. I sort of knew intellectually that healthcare is something that people worry about. They care more about their own health than they do about healthcare policy. They don't want the government interfering with their healthcare. They hate the idea that insurance companies interfere with their healthcare. But when you're lying there on a gurney, you understand that in a very different way. And what you understand is that you're not worried about the cost. You're not doing a cost-benefit analysis. You're just worried about the benefit. And it's what makes healthcare, I think, and I think I explain in the book, it's what makes healthcare something different from any other commodity we buy in the marketplace. We know nothing about what we need. We have no idea what the price is going to be. We have no idea what the bill says or how to explain it after we get it. And we have no comparison of what's effective and what's not effective. Indeed, as you know, because there's a scene in the book, I end up interviewing the CEO of United Healthcare about Obamacare and various policy things. And at the end, I took out an explanation of benefits I had gotten from his company, which said amount billed $0, amount you owe $124. And I said to him, can you explain that to me? I handed it to him, and he looked at it and he looked at it and said, I couldn't explain this to you if I sat here all day. I don't know why they sent it to you. Well, of course, the they is him. And I think that's sort of emblematic of just how dysfunctional the private healthcare system is in the United States.
Is there then anything for the consumer to do to fight back against 400% increases on drugs and on the use of medical machines and on doctor costs, hospital costs? Or are we simply at this point going to be hostage for the rest of our lives, or at least our known lives, to what is a system that is out of control?
Well, the whole story of America, you could argue, is whether lobbyists have more control over what happens in Washington or the people do. And only when we face a crisis in this country do the lobbyists get pushed aside and does the people's will get done. I think sooner or later, this is going to cause such a fiscal crisis that basically we're just not going to take it anymore.
But when we get to that point, where are we going to go?
Well, where we can go is we can become a country that controls the price of prescription drugs the way every other country in the world does, that controls the price of medical devices, and that controls the profits and the profit margins and the prices of so-called non-profit hospitals, which pay no taxes and charge people $77 for a box of gauze pads.
Sounds like what you're talking about, though, would be a generational fight that might take decades to pry this power away from people who make $8 million a year.
Well, it's taken decades even to get where we are today, which again I think is sort of a half victory in the sense that we've given more people health care, but we're just not going to be able to afford it.
You really need to read the book because it brings up so much, and I got to tell you something. When I read pieces of it, and having a background in my family in medicine, and they telling me what they have seen with regard to charges and costs over the years, it makes me think that one of these days we may just as well go back to putting roots and salve on our wounds to try and cure it by the time we get there. Reminder to everybody,
Who knows?
The book is called America's Bitter Pill, and indeed that's what Obamacare is and what the lawmakers and the lobbyists are doing to America. Every single day they keep feeding us that bitter pill of medicine. Stephen Brill, fascinating book. Thank you so much for your time.
Thanks for having me.
My
You're
pleasure.
quite welcome.
Next up here on MidPoint, Telling It Like It Is has a challenge for my broadcast peers to stop seeking web hits and stop giving a platform to the phony Islamic cleric who spews nothing but bile and hate.